take 10 out of the top 20 aircraft companies in the world, HCL will be part of that bill. Similarly, medical appliances, we've been building for the last 12 years, not 12, 14 years. Having this technology orientation, having this adjacency orientation, and having this value system, it took us naturally to see who are the partners that we can work with, because no one can form everything. That partnership, working with another partner, comes to us very naturally, to be the best in the world. And thereof, we had decided to work when we decided to address India's massive healthcare issue. Johns Hopkins, who are, without any questions, the best in the world. It's very hard to find an institution which has in its bag 37 Nobel laureates, which is more than all Asia has produced.
It's our commitment to excellence, our commitment to humanity that I think really pervades the institution. But I think another very important feature, and again is reflected in our involvement in this new initiative from HCL, is our commitment to internationalization. And here, Johns Hopkins, apart from having campuses in the United States, also has campuses in China and in Italy. We have international activities in the Mideast, in South America, in India. Indeed, we are involved in healthcare activities, usually with a strong research focus in virtually every continent of the world. This past year, Johns Hopkins received more than $275 million to support healthcare research outside of the United States. Again, this underscores our deep commitment to this area, but also our confidence that as HCL Healthcare grows, that Johns Hopkins can play a very important complementary and supportive role, and we couldn't think of better partners to be involved with than HCL in this very exciting venture. Thank you.
We will play in the full spectrum of the healthcare. Our goal is not just to build one hospital or build few clinics. Our goal is to touch millions and millions of people in India. And to do that, healthcare, HCL is going to be in healthcare delivery, which is going to have clinics and hospitals, and whatever is required to really reach people and communities. And as we build this company, we're also going to explore. HCL is going to be in diagnostics. HCL Healthcare may be in devices. HCL Healthcare will explore insurance. But also HCL Healthcare is going to provide informatics and analytics. So it is the beginning of creating a new ecosystem for healthcare, which we have a chance to do it right. We are looking for the partners. And that is why it is truly a privilege to have Johns Hopkins as our partner, with whom we will share knowledge. They will guide us in the best practice and the quality standards. There is mutual interest of both the organization, because at the end of the day, the goals of Johns Hopkins Medicine and HCL Healthcare is the same.
Our first offering will be our multi-specialty clinics, an area where, given our strengths, we will be able to contribute the most in the short term. This will be the first set of offerings led by HCL Avitas and HCL Healthcare. We aim to establish ourselves as a long-term care partner to our patients, drawing upon the expertise of Johns Hopkins to deliver the highest standards of clinical care possible. In the current scope of the collaboration, Johns Hopkins will advise HCL Avitas on the development of the clinical programs. They'll assist in medical affairs. They'll provide trainings, quality improvement, patient safety, and providing the best global protocols and again, standards.
We have modeled our clinics around a theme which we call the patient-centered medical home. Now, this is a theme which has been very, very successful in both the US and UK, and this is something which we have been bringing together into India with the help of Johns Hopkins. Right. In a patient-centered medical home, patients will be treated and they'll get the best of clinical care in a very warm, patient-friendly format. They will be treated with empathy, they will be treated with respect, They will be informed and involved in their medical decision making. And through our association with Johns Hopkins Medicine, we will have access and we will bring the best of clinical care in terms of standardized treatment protocols and in terms of standardized pathways. We aim to have 1,500 doctors in our employ, and we will treat 50,000 patients on a daily basis. Clinics will be spread across India, but the important thing is that every one of our clinics will be connected through technology, and they will have the highest standards of clinical care.
Shiv, could you give us a sense of the investment that has been planned for the venture?
Our initial outlay for the equity is 1,000 crores for the equity. And we expect that should there be a need to add to it, HCL Corporation will add to it. And it'll be good for you to know that in the first 10 years, we have no plans to list. So we would not be under any pressure of a listed company, like this should be the profit per doctor or a profit per patient. There are wrong values. It won't apply to this industry. We will evolve our own.